Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program on 96.5 FM, 1080 AM, or you might be listening to the Great Lakes Health Radio program on Google. Welcome, welcome, welcome. And if it's your first time, I'm so excited that you're here listening to us. Our objective today is to educate you and give you a little more knowledge about the healthcare system within Kaleida Health. My name is Francesca Messiah. I'm the manager of workforce development from Kaleida Health. And you may wonder, who is Kaleida Health? I know I say this for years, I've been having this intro, but I just want to make sure you know who Kaleida Health is. We're the hospitals. We're Buffalo General Medical Center. We're the Gates Vascular Institute. We're Oishei Children's Hospital. We're Millard Fillmore Suburban. We are the DeGraff Medical Center. We're also the DeGraff Long-Term Care. We're High Point on Michigan. Matter of fact, our conversation today will be talking about long-term care, talking about High Point on Michigan and DeGraff. We also have clinics throughout Buffalo. Also, north of in Buffalo, the northern suburbs, Amherst, Williamsville, we have clinics in the, did I say Hamburg? I'm sorry, Hamburg is south of the city. We do have clinics and services available closer to you if that's where you live. And we also have clinics closer to the Williamsville, Clarence area if that is where you live. And we have Great Lakes Cancer Care Collaborative. Great Lakes Cancer Care Collaborative is a collaboration of physicians called oncologists who treat patients with cancer, screen you for cancers. We have the social service support that helps our cancer patients and families. And this is Breast Cancer Month, Breast Cancer Awareness Month. So women, I'm just going to say a special word to you, and men can also get breast cancer. Please, please, please get screened. If not this month, do it next month. And just everyone, please don't forget about your health screenings. And also, I have to mention, Kaleida is hiring. So if you're interested we have career opportunities in all areas: clinical, non-clinical, maintenance, clerical. We have it for you. Please visit our Kaleida Health website at www.kaleidahealth.org and then look for careers. Well, okay. Our topic for today is we are talking about long-term care, rehabilitation, and staffing. We're going to talk a little bit about jobs as well. Our guest for today from long-term care, that's High Point on Michigan, and DeGraff Rehab. So High Point is in Buffalo, DeGraff is in North Tonawanda. And our guests for today are Jonathan Hart. Good morning, Jonathan. How are you?
Good morning, Francesca. How are you?
Great. And Jonathan is a vice president of long-term care. And joining Jonathan is Angela. Angela, I think I mispronounced your last name. Could you say your last name for us?
It's Mosteller.
Okay, Angela Mosteller. And Angela Mosteller is talent acquisition partner. You may ask, because I had to ask it first, what is talent acquisition partner? Meaning that person that helps you get a job, interviews you, screens you. So Angela and Jonathan together make one heck of a team.
That's
so
perfect.
yes. So let's start off with the interview. Jonathan, Angela, could you please describe what is long-term care and rehabilitation? Is it open 24 hours? Just talk about it. Where is it located and what makes High Point a unique facility? So that's really 4 questions in one.
Well, thank you, Francesca. And I just want to welcome your listeners as well. It's our great privilege to join you in your show and our Western New York neighbors to talk about what Kaleida Health long-term care is. And you gave us a great introduction, so I appreciate that. So Kaleida Health Long-Term Care consists of two long-term care facilities, High Point on Michigan, which is on the Buffalo General Medical Campus, and DeGraff Rehabilitation and Skilled Nursing Facility, which is out on the DeGraff Medical Park in North Tonawanda. And I think your introduction and what is Kaleida really set the stage well, because Kaleida Health is committed to caring for the needs of all of our neighbors. And that's at whatever stage in your life that you are. And long-term care isn't necessarily just for the elderly. For us, long-term care will support our neighbors that need a little extra help, after an acute hospitalization, in what we call subacute services or short-term stay services, where we'll provide rehabilitative services that help them get back on their feet, whether it's occupational, physical therapy, speech therapy, or respiratory therapy, to help them get back on their feet so that they can either go home or back to their assisted living. And the ages range, at High Point on Michigan, we have a 20-bed pediatric unit. So we have children as young as months old to 22 years or 21 years old on that unit. And then we go into our subacute population, which could be mid 50s, 40s to anywhere up into their 80s. And then we go into our long-term care and dementia population. And both DeGraff and High Point serve the subacute population, although High Point exclusively has the pediatric team.
What is subacute?
Subacute is a service that we provide that will help support you. So it's typically after somebody has had a acute hospital stay and just needs that little bit more support before they go back home. But nowadays, as we enter into this population health model, our subacute services are also caring for people that are admitted directly from home. People that don't need an acute hospital stay, but could use a little support with either the physical therapies or occupational therapy, like I discussed earlier, or maintaining their medication or just addressing a short-term medical issue like dehydration or they weren't taking their medications correctly and got confused. So really, I would like to say subacute is what the acute hospitals were probably 15, 20 years ago. As the acute hospitals got more complex in the care that they provide, that trickled down to us at High Point and DeGraff. We're doing IV antibiotic therapy. At High Point, we're doing respiratory therapy for ventilator-dependent residents or residents with trachs. We're weaning people off their ventilator so that they can go home. And that especially with our pediatric unit, which it's the only unit of its kind west of Albany. And these 20 beds are critically important to our community because without these 20 pediatric beds, these children have to go to the Albany area for care. And then once there's a bed available, we will admit them once they get back.
So to me, that also answers a question: what makes High Point unique? And being able to have your child here in Buffalo, and if you're and having your child stay in Buffalo, versus because of the child's medical needs, sending them to Albany. To me, that is something that would definitely set you apart. Set High Point.
Absolutely, and I do believe that being part of Kaleida is what sets us apart. Yes,
absolutely.
Kaleida Health, the fact that we're part of Kaleida Health, we have access to specialized services that your other community long-term care facilities don't have. Mm-hmm. We take very medically challenged cases that other nursing homes just can't handle. For example, we're currently in the process of filing a certificate of need with New York State to increase our ventilator beds and to add a dialysis den on campus. so that we could meet the needs of a ventilated dialysis patient, which right now has no other place to go but remain in the acute sites. And the nice thing about DeGraff is DeGraff it is a amazing facility in North Tonawanda. They're a 5-star facility. They have an amazing staff, which is really the difference. That staff is just their community staff. That's a community nursing home. It's your neighborhood nursing home where the staff there live next door to the people that they care for, and they truly love every patient like it's their own.
Although you might have staff who don't necessarily live next door and commute from Buffalo or Hamburg or Williamsville to take care of the patients at DeGraff, correct?
That's correct. And they make
residents. They're residents, right? They're residents.
Yeah, the residents we admit from all over, but the staff really, the long-term staff out there, there is a bond and a passion for what they do and their commitment to our Kaleida Health mission.
That's wonderful. And I know I've attended a few things in the past out there, and the residents, like you said, are passionate, as we all are, passionate about what's near and dear to us. And I'm glad that Kaleida is still and remains right there in the community. They've been there for many decades. Question: when should a family consider? I know you mentioned 3 levels of care: acute, subacute, and memory care. When should a family consider possibly having their loved one evaluated to go into either High Point or DeGraff? At what point? What does that look like, especially if the person isn't in the hospital?
That's a great question, Francesca, because I think people often wait too late and then they feel pressured into making a decision. So we're experiencing this right now in my own family with my father-in-law, whose health is starting to decline. So I've been working with my mother-in-law and my sisters-in-laws and my wife to really start this process now, to really develop a how much support can we rally around him now, and at what point does it make sense, especially for my mother-in-law's health as a primary caregiver, to make that decision to go to a more structured level of care. So I think it's probably personal for every family. My mother-in-law's just they've been married over 50 years, and she's just a very dedicated caregiver, but not everybody has the gift of her good health and everything else to be able to do that. So I think it's a conversation every family should be having now, and at least they should be at a minimally be talking about advanced directives. What is it that your loved ones want? And that's at all ages, really. What is it that your loved ones want as far as measures taken to sustain their life? And what are their wishes when it comes to, what kinds of medical care would they want? We have these discussions frequently far too late at the acute when it's an acute medical episode. But the 2 topics are really linked together. Have the discussions about what the advanced directives, what the families want, and then have that discussion. At what point do we want to either move into an assisted living facility or long-term care? Because quite honestly, my mother-in-law doesn't want to be a burden on our family, and she's not. We all love her. We all want to surround about her, but that's this generation. So we have these discussions frequently.
Mm-hmm. And okay, so then also when we're talking about, a lot of times, families also struggle with when to think about, I hate to use the words putting in, when to make arrangements for their loved one to go into like a memory care. At what point is there's no such thing as a good time, but at what point should the family member consider, if someone is developing Alzheimer's or dementia, now it's called the memory care unit, but at what point, what are things that the family should be looking out for?
So And I think it's not only, I think that's a great point. It's not only memory care, but it's also the physical health piece that because dementia is a physical disease, just like end stage renal disease. So I think it really becomes two things. When it's unsafe to care for your loved one at home, meaning you're not able to provide the services to maintain their safety. And safety isn't only physical safety, but it's also, their mental health, their spiritual health, making sure that they are, what we often see are caregivers that become increasingly isolated at home. With just the primary caregiver and the person that they're looking at. So when that starts to become an issue, I think that's the time to have that serious discussion about moving out of the independent home into a more into a more structured level of care, whether it be assisted living, a memory care unit, as you discussed, or a skilled nursing facility.
Well, and if they're there, can they visit? Can they visit the loved one? When can they visit?
They can visit 24 hours a day, 7 days a week. This is their home, and we treat it as their home. If you're somebody who had visitors at the overnight, and believe it or not, we have people who stop in on the overnight. They're welcome.
Yeah, I remember many years ago when my aunt was in she needed rehabilitation after being in the hospital for a lengthy period of time, needed help with walking. And I remember I used to visit her on Fridays after I finished going out. And it was really nice. I would just go, it was allowed. So I didn't know and it was like 10 o'clock at night. I don't know are you allowed visitors,
Yep.
if you know that they're still up?
Yep, 24 hours a day, 7 days a week.
Okay.
Again, this is their home. We work where our residents live. It's not the opposite way. We work in their home, so we treat it as such.
Okay. Well, I know that last week we had here in Buffalo, was a Buffalo Niagara Medical Campus student open house, and I want to thank Angela for being there. But I remember there was a young lady who was interested in the art, so she had the creative side. But her mother said she's also good at math and science. So on that creative side, planned activities. When someone's a resident, do you have activities for them? And can the community come and different groups come and do activities with the residents?
We have an amazing activities department. So yes, and they're speaking of creative. So they launch activities that are that go out from the kids doing a Peter Pan Neverland party for the kids, and then doing a veterans recognition event or a Hispanic History Month event. So they are the fun in both campuses. The activities department out at the Graff Rehabilitation and Skilled Nursing Facility and here at High Point on Michigan. They bring the fun for both the residents, their families, and our staff. And it's a beautiful thing when you can see the three mesh in that activity setting. So, and we encourage volunteers, frankly, because and that's one of our biggest needs now after COVID is rebuilding both of our long-term care sites volunteer team. Matter of fact, if people are interested in volunteering, they can reach out to Jordan Bidwell.
And another reason for asking that question is because I know a lot of groups now are planning what they're going to do in the community at holiday time. And I believe they're like welcome to come and do a caroling session with either the younger, the pediatrics, the younger people, or the older people. Is that true? Should I be?
Oh, we would love it. We would love it, and they could either connect with Jordan Bidwell, and I'm looking up her number now, or they could email me, John Hart at JPHART at Kaleida, KALEIDA Health HEALTH.org. And if they want to connect with Jordan Bidwell is our volunteer service coordinator, and she can be reached at 716-748-3242. Again, her number is 716-748-3242. And I can't emphasize enough how important getting the community back involved in our facilities will be. And I hope your listeners out there know that it doesn't have to be a huge time commitment. It could be just whatever you can give is what is the best that we'll take.
And it doesn't have to be a large group. So if your group normally has 20 people, it can be 5 people. Because the residents, it can be one-on-one, because the residents we know are very, very appreciated.
And it's that compassionate one-on-one time. And I can tell you, it's one of the most beautiful stories I ever saw is when I worked at another facility, and there was a young student from one of the area high schools that came in with a group and bonded with one of our grumpy old men that seemed to be grumpy to everybody. But he and this young man just had such a beautiful bond that when the student would come in, they would sit downstairs, they would play cards, and the resident was a completely different person. And I believe it was just that he felt like a human being. He didn't have any family that visited him, and I think he would see everybody else's visitors and get hurt and angry. And then when this young man and he bonded, it changed both of those lists. Matter of fact, that student went on today to be a geriatrician.
Oh, that's wonderful.
Went on to medical school and is focusing in geriatric care. So it's just amazing how that experience changed two people's lives.
Right. Well, I just want to remind our listeners what we're listening to today, the first part of the Great Lakes Health radio program. We're talking about long-term care, rehabilitation, and staffing at the facilities. And our guests are Jonathan Hart and Angela Master from High Point and Michigan and DeGraff. Next, moving on, staffing, working in long-term care. Could you please, and I know, Angela, I've seen you at work, and could you describe what types of positions, if someone is like, I want to work in long-term care, what types of positions are available, and how do you apply?
Absolutely. Francesca, thank you again for having me on your show. As a talent acquisition partner, I have to say working in long-term care has been an amazing experience, from working with our elderly population to the children in our pediatric unit, and also working alongside of the many healthcare professionals here at our facilities. We offer a paid CNA training program for
CNA?
It's a certified nursing assistant, and the paid CNA training program are for those who are interested in exploring a new career path in the healthcare field. And it's a great opportunity to work alongside of the many healthcare professionals here at our facilities. So also with that, working in long-term care, the paid CNA training program experience is not preferred or required, for those who are actually looking for a career change in the healthcare fields. So those who come in for the paid CNA training program, it's a 4-week training program, which they can apply at our Kaleida Careers page for High Point, Michigan, and DeGraff Skilled Nursing Facility. Upon their certification, we are also a testing site where they can take the New York State exam here at our location within 2 weeks from their graduation, and then transition into a certified nursing assistant position where they'll be working in our long-term care healthcare facilities. We offer many career opportunities. We hire, again, certified nursing assistants. Certified nursing assistants are those who work alongside of our patients and residents, make the last years of their lives the most memorable, the most comfortable, and do for them what the patients and residents cannot do for themselves. Along with licensed professional nurses, registered professional nurses, We have a food service department, housekeeping department for those who are interested in just joining our career fields and exploring the many opportunities that we have.
Mm-hmm. And I know you also have cooks. You have positions for cook. Do you have security guards? I mean, High Point is High Point and DeGraff are both, even though they're long-term care facilities, they still would have the same staffing that you would have in a hospital because both are open 24 hours a day, 7 days a week.
Absolutely. We have many shifts available due to it being a 24-hour organization. So we offer shifts on our days, evenings, and overnights for our clinical staff. The dietary department, we have nutritional service workers along with cooks. For our environmental services department, for those, who keep the cleanliness of our facilities. And we also hire positions such as child life specialists. We have physical therapists, respiratory therapists, occupational therapists for those in the therapy field. So there's plenty of career opportunities here at our long-term care facilities.
So if someone's interested in looking up one of the careers, one of the jobs, would they go to the Kaleida job career, or is there a separate place for High Point? What should they do? Or and DeGraff, High Point and DeGraff, sorry.
Absolutely. We encourage people to follow our Facebook page, which is High Point on Michigan, and look out for our future open interview dates that we have upcoming in November. They can go to the Kaleida Careers page, or they can reach out to me directly. They can text at 716-913-6121, or they can email me at armosteller@kaleidahealth.org. So visit the Kaleida Careers page for long-term care. Our locations will come up. Again, we have High Point on Michigan, which is located in downtown Buffalo, and DeGraff Skilled Nursing Facility, which is located in North Tonawanda.
Yes. Thank you so much. And we only have about a minute left. So John, just tell me one thing you'd like to say in closing.
That one thing would be how proud we are of the staff that work at both of our sites and the career opportunities that we're able to provide the community. I'm proud of the number of staff that, begin their career as a frontline staff member and then take advantage of the educational support opportunities that are available to then go on to bigger and better jobs. So
thank you. And Angela, one comment from you before we go.
Like I said, I look forward to hearing from those who are looking to explore their future career opportunities within the healthcare organization. And we're currently interviewing for certified nursing assistants, licensed professional nurses, registered nurses, and even those who are not sure of what exactly it is that they're looking for, they can just give me a call and we can find something for them.
And call her at 716-913-6121, correct?
Correct.
Okay, great. Well, I want to thank you both. I can't believe a half hour is up. So I want to thank both Jonathan Hart and Angela Mosteller from our High Point on Michigan and DeGraff Skilled Nursing Facilities. And if this is your first time joining us on the radio, I want to say thank you so much. And hopefully you listened, you heard the first part. And the first part of our program today is where we talked about our long-term care facility called High Point at Michigan. So hopefully you heard that. But today's topic is something that many of you in the community throughout have shared with me. And those stories are pain management, chronic disease. Well, our guest for today is Dr. Paul Shields, Chief Executive Officer and Chief Medical Officer for the Great Lakes Integrated Network. Good morning, Dr. Shields. How are you?
Good morning. Thank you for having me.
Oh, you're welcome. Did I get your title correct?
You did. Yep.
Oh, okay. Thank you. Well, Dr. Shields, when our colleague Julie shared with me all the things you can talk about, I just decided to take three of the topics. So today's topic, we're combining three into one. We're talking about chronic disease management, patient engagement, because it's a patient who has a chronic disease, and healthy lifestyles. And healthy lifestyles goes in with the patient, going back to chronic disease management. So listeners, our show for today will be discussing not only chronic disease management, what you as a patient should think about doing if you're not doing already. Many of you are probably doing it, and that's patient engagement and healthy lifestyles. Talking about healthy lifestyles, so when you have chronic disease, could help you. Does that sound right?
Yeah.
Dr. Shields?
Yeah,
okay.
Absolutely.
Well, our first question, how does chronic disease management, patient engagement, and healthy lifestyle tie together? And can we separate the three?
So I think they are intricately tied together. Obviously, they have to come together, but just in practice, they separate uniquely. So chronic disease is something I think that we as providers of healthcare do a pretty good job of telling patients, this is what you have, that you may have wrong with you. You may have diabetes, you may have hypertension, COPD, CHF. But what we don't necessarily do a great job of today is giving you all of the information that you need to understand how you manage that. So you get to take your body to the doctor, get your diagnosis, get your prescriptions, get your treatment plan, and then you take your body back home with you and back to your community, and you have to manage that condition. So healthy lifestyle, engagement with other care providers, nurse managers, dietitians, pharmacists. How do we get to the point where those are all intersecting so that we don't feel like we're managing our chronic disease by just seeing our doctor 3 or 4 times a year? The rest of it is 365 days. And so much of that is, quote, non-medical, right? Eating well, exercising, maintaining a healthy cognitive and physical lifestyle. That doesn't happen when you're in your 30-minute encounter with your physician. It happens at all the times outside of that. So they are tied together, but they do separate in how we actually confront them.
Oh, okay. Thank you. And when we talk about chronic disease, and the information that I had was heart disease, high blood pressure, diabetes. And my question is, what is the difference between high blood pressure and heart disease? Because I thought high blood pressure was a form of heart disease.
Yeah. So theoretically, high blood pressure is probably not as related to the heart as it is to the vessels, the vasculature, and the kidneys are actually more related to high blood pressure. So blood pressure is simply a measurement of the pressure of the blood within your veins and arteries within your body. The heart is the pump that is pumping blood through. But the reason people develop high blood pressure is oftentimes because their arteries have calcium in them, the arteries have cholesterol in them, the arteries have other conditions that make them stiff and less responsive, so that the blood being forced out of the heart is actually creating a high pressure within the vessels. Heart disease, when we talk about heart disease are those conditions where you would think about coronary artery disease, or the condition that would cause heart attacks in patients, or thickening of the muscle of the heart, what we would call cardiac cardiomyopathy or hypertrophic cardiomyopathy. And those conditions, when the heart is adversely affected, can raise or lower blood pressure, but blood pressure in and of itself is really more related to the kidneys and the vessels than it is the heart per se.
Okay. And now let's loop in that last disease when we talk about chronic disease management, and that being diabetes. Does diabetes impact heart disease or high blood pressure? Absolutely.
Diabetes is what I would consider a systemic condition. So while diabetes at the easiest explanation is poor control of glucose, so your sugar levels are high in diabetes, when those sugar levels are high, they affect all of the organ systems. So they affect your nerves. People will talk about getting numbness or burning pain in their feet and hands. They affect the blood vessels. So people have high blood pressure. They have coronary atherosclerotic disease, where the vessels get thick and hardened because of the high sugar levels. The high sugar levels can affect your GI metabolism. So how you move your bowels and how you make urine and how you urinate. You'll urinate more frequently when you have high sugar levels. So they affect really every organ system when you have diabetes, even though diabetes is really at its forefront controlling sugar levels. Those high sugar levels have significant adverse effects. It's kind of like having a leaky roof. When you have a leaky roof, the problem is in the roof, but all of that water leaking in damages the plaster, it damages the carpet. Over time, it can cause mold, it can cause rot. So it is a much bigger problem than just controlling sugar in diabetes.
Wow, thank you. So why is it important for listeners to maintain chronic disease throughout the year? And my favorite question that I ask people, especially on special occasions or unexpected occasions, people say, well, it's a special occasion, so we're going to eat this and have that. Or you have unexpected occasions, such as death, where again, a lot of people have food. Why is it important for listeners to do all they can to try and maintain chronic disease throughout the year?
So it is critically important to, especially with conditions like diabetes, where you could have, if you ate too many carbohydrates or ate too many sugars, you could have a significant rise in your blood sugar. So that's one time could cause that effect. So it is critically important to really balance that. And that doesn't mean that you have to be on such a regimented plan that you can never, ever enjoy life, right? So this is a chronic condition that you're going to have for the rest of your life. And you have to temper your response to that in something that's sustainable for the rest of your life. So it would be easy to say, no carbs, limit all that you take in, eat fruits and vegetables on a regular basis, stay away from, but people do that when they go to the extreme, they do that temporarily. They don't do it long-term, and then they kind of fall off the wagon for that. So usually what we'll encourage patients is that, you're 99% of the time you're following a regimented diet, but you should build in opportunities where if you have a sweet tooth and you really feel like the quality of your life benefits from having a piece of pie or a sweet, then you need to make sure that the rest of that meal wasn't carb heavy. So you should have a protein meal that allows you to have that limited amount of carbohydrates so that it's sustainable and enjoyable. Because the last thing we want to get to is managing chronic disease where your quality of life falls off. This is a marathon. This is not a sprint. So you don't get to manage diabetes for a week or 2 weeks. We have to figure out what that process is over the long term so that you can be healthful. In a lot of cases, you'll find that if patients can make a longitudinal, kind of a long-term adjustment to how they're managing it, you'll see weight reduction and better control of some of the other chronic conditions that then allow you to sort of liberalize your diet as you go on. But if you make no changes and continue to struggle with weight control or continue to not adhere to a diet, then in later stages of life, it's going to, by necessity, get even more regimented and restricted. So there is a path forward where you can work with your physician, work with your nutritionist, work with the pharmacist on discussing what's appropriate, what are so-called cheat days or cheat meals where you're allowed to have a little bit extra, and how do you manage your medications around that so that you don't run into consequences or complications. It's not an end-all be-all kind of you can never have this again. There is an ability to tailor that, but over the long term, it has to be very regimented around eating the right things, getting regular exercise. And as you can control that chronic disease to a point of wellness or idealized wellness, there is the ability to build those opportunities in so that life can be enjoyable as well managed.
And I tell you, one of the things that it's a word I don't really understand because it doesn't necessarily work all the time. And people always say, well, I can have this in moderation. And many times I'll respond, but it seems like you have to get things under control before you start moderation. Talk about moderation. People love saying, well, my doctor said I can have this in moderation. Where does moderation fit in?
So when we talk about chronic disease, when we talk about hypertension and sodium load, or we talk about diabetes and carbohydrate and sugar loads, moderation is kind of that term that you would say to somebody offhandedly, maybe at a church event or out in the community. You say, well, I can have this in moderation. But moderation cannot be decided on a whim, right? So you go out and you decide, well, I'm going to have pizza and I'm going to have cake and because my doc said I could have this in moderation. Moderation needs to be predefined. So moderation should be, you can have 3 times a week a half a piece of pie for dessert, if that's what you like, and have a mutual agreement to where you define moderation. Because otherwise, in the human nature of things, when we hear moderation every day and every meal, we adopt moderation and we allow that to come in. So it should be predefined and it should be quantified. Moderation is, I'm allowed to have dessert with 3 meals a week, or my doctor says that I can have pizza twice a week. It has to be predefined. So there is a moderation, but moderation means nothing if it's not defined.
Thank you. And you talk about desserts. I used to always jokingly say that my mother had sweet teeth, not a sweet tooth. Her thing was chocolate cake, so she wouldn't eat. But she got in her 90s. She did develop portion control. So I was very proud to see when she was in her 90s because things really clicked. But moving on, if somebody with high, and I've been doing a lot with food as medicine, and if someone has heart disease, diabetes, or hypertension, and they go for 2 weeks living in that zone, that the zone they should, is it true that your numbers, your cholesterol numbers, your glucose numbers, things will begin to decrease if you watch what you're doing? If you take control of yourself for 2 weeks, stick to what you're supposed to eat. Is it true that your numbers your numbers will begin to drop?
Yeah, so absolutely 2 weeks. If you look at a glucose level in a diabetic, really probably 3 to 5 days of following a controlled diet, you will start to see improvement in glucose levels. If you're looking at what we call a hemoglobin A1C, that level is a little bit longer term. So that takes probably 10 to 12 weeks to really see that number change. But finger stick glucose, within a few days of controlling your carbohydrate intake, managing it with proteins, you'll see improvement with that. In a hypertensive patient that can restrict sodium and can stay well hydrated, you can see blood pressure improvement within a few days, definitely within 2 weeks. The long-term benefits are additive to that. So 2 weeks, 2 more weeks, before you know it, you're 3 months, you're 6 months, you're 12 months, you're 5 years into control, and those numbers have improved. Cholesterol, there's a couple of different numbers that we look at in that. So the total cholesterol, that splits into 2. One's called LDL and HDL. They used to call them good and bad cholesterol. And then there's a number called triglycerides. Triglycerides are going to be much more rapidly affected by diet. So within 2 weeks, you could definitely see an improvement in triglycerides, or to the other, a worsening. So if you're eating a bad diet, just 2 weeks of a bad diet can dramatically shift those levels. The total cholesterol, the LDL, HDL, that takes a little longer to see. I would suggest that patients don't look at their labs 2 weeks into a lifestyle change. Probably more likely at 2 or 3 months, you'll see those numbers improve, but they will definitely improve with diet and lifestyle changes. And the triglycerides can shift within a few meals, quite honestly.
Wow, that's wonderful. How about, okay, and like I said, this is not easy. So listeners, we're not making it seem like it's easy. We're just sharing information with you. You know, we know that many times you just can't stop overnight. So in this conversation with Dr. Shields, where we're talking about chronic disease management, patient engagement, healthy lifestyle, we're aware this will not happen overnight, but just for you to, if you're not doing this, things that to consider, because because it's just healthier. It's a healthier lifestyle. Well, Dr. Shields, some communities lack grocery stores that sell fresh fruits, and grocery store, they don't have access to grocery store delivery. I forgot what that's, Instacart. They don't, many communities do not have that. Not may not. They do not have that. So if you're going into a store that one of the frozen food sections, is there anything that you would recommend if their only option is frozen foods at the corner store to maintain diabetes? Yeah.
So I think and I fully appreciate the food desert, the dearth of available fresh food. I mean, if I had my druthers, it would be fresh fruits and vegetables, but I fully respect that is not an option in most of the communities that are surrounding us today. I think there's also a challenge, and this is my perspective, but even frozen foods are a challenge in a significant number of households who may not have the capacity to maintain those frozen foods. And we think, we walk up to our fridge or our freezer and we take it for granted. That is not necessarily a staple across the community. In the same community that is challenged with access to fresh food, sometimes frozen and refrigeration is a challenge. So I often will encourage, there are great alternatives in the canned vegetable section. The key that you have to look for is the sodium content. So sodium has been a preservative in this country since, it really came into the forefront in the 50s and 60s. But if you can find a low sodium content canned vegetable, you can use that for a lot of the fiber content. There is still some retained nutrient value in canned vegetables. The process has improved dramatically over the years. What I would recommend to people who cannot get the fresh fruits and vegetables and instead go to a canned vegetable or a canned fruit option. In the canned fruit, you want to look at the sugar content. Ones that are in natural syrup are much healthier than ones that are in some sort of a fructose or high fructose environment. But the other thing that I would add to those members who have to do that is to get a good multivitamin. A good multivitamin supplemented with the fiber and the content of canned vegetables and fruits can get you pretty close to fresh fruits and vegetables.
So so a multivitamin, oh my God, there's so many vitamins on the shelf. Which multivitamin?
Least expensive multivitamin, just a general, not for men, not for women, not for over 50, not if your name ends in Y, a good, cheap multivitamin.
Oh, okay. How about if with the syrup, you talk about, like a lot of the canned foods they're preserved in something. Does it help to wash, to take the syrup and strain it? I mean, take
Absolutely.
The fruit, strain it off, rinse it off. Does that help to get rid of?
Even just straining it, I don't even think you have to rinse it. But the ones that are in a high fructose or a corn syrup base or a syrup, if it doesn't say, natural or in its own juices, just straining it through a strainer or cutting the can with a hole and dumping that syrup off, that's where the majority of the calories are going to be in that. And the calories that aren't countered by the fiber that comes within the fruit. So straining that syrup off and then eating the fruit, the whole fruit that's in there is a much healthier option. Quite honestly, even if you're not diabetic, it's a much healthier option.
Thank you. When we talk about the patient, the listener, maintaining a healthy lifestyle, let's say they have limited mobility. Well, I'm going to first start with walking. How beneficial is walking? If it's walking around your neighborhood, your church parking lot, walking through your home, how beneficial is walking?
It is probably the most beneficial form of exercise that we don't do enough of as a community. It cannot be overstated. Walking and mobility, getting up and moving, even if you're walking around your apartment or make 3 laps from the living room to the bathroom to the kitchen, and commit yourself to do that every 3 or 4 hours if you're confined to the home and can't. The more you walk, the less likely you are to not be able to walk later in life. The less you walk, the more likely you are to end up not being able to walk later in life.
Mm-hmm. Yeah, I forgot what someone recently had shared with me on walking, what their physician had said, but it was something about walking in your health, but it made sense. And I just, when people say they can't get to a gym, but can you walk? Just, and I always say, not all neighborhoods are safe, but maybe just walking around the church parking lot if you go to church, but don't go in between cars. But I just try and always think of, or walking in stores, when you get to the store. So just want listeners to know.
Patients ask me, how much should I walk? And my standard answer is more than you are today.
I like that. I do like that. What are some other tips you share with your patients?
Yeah,
chronic disease.
I think that the key really, and this is, this is kind of something that I think we've known for a while, but I don't know that we do a very good job of telling people what's wrong with them in the healthcare community. You go to your doctor, you get a list of diagnosis, you leave, and you know what you have, but you don't know what to do about that. So that's health literacy, right? You don't have to be an expert in diabetes, but how does diabetes affect your body? That's all you need to know about. You don't need to know about what it does for everybody else. And the thing I think that we have come away from over the last 20 years is the only way you're going to get more healthy is if you go to the doctor more, right? Make an appointment, go to the doctor. The more you go to the doctor, that does not make you more well. What you do with that information, what you do with it when you get home is really critically important. And quite honestly, 2 and 3 generations before this were much healthier because they did things like walk to the store. They did things like go out and work in the yard. They broke a sweat every day. Those are the important things. And I think people think, well, I'm not really doing anything today, but I need to join a gym and I can't afford to join a gym. I would encourage patients that joining a gym is probably the last thing you want to do first, because what happens is you're out of shape, you go to a gym and you hurt yourself. You pull a muscle, you twist an ankle, you irritate arthritis, and then you're even less active. So it's about scaling in. It's about building progressively into what you can sustain. And I know it sounds simple, but honestly, just walking around your apartment or your home has a lot of values, especially if your apartment has stairs. You don't have to climb the whole flight of stairs, but get up the first 2 and turn around and come down. Get up and do 10 reps of that and then go sit down. Do something more than you're doing today. Progressive exercise and activity. You don't have to run a marathon, but if every day we say, okay, I'm going to do 3 sets of 10 reps of that, and next week I'm going to do 4, that progressive build is sustainable in the long term. It can be enjoyable. You can make it something that you're feeling the benefits of over time, and not to the point where you say, I've got to go get on a treadmill for 35 minutes. If that's your starting point, you may never do that. But how about a treadmill for 3 minutes and do that for a week?
Yes. Dr. Shields, I have to say our time is almost up. I'm hoping to have you back again. And I'm going to have you back again.
I look forward to it.
Yes. And if someone wanted to contact you, are you taking new patients?
So I don't see patients in the community. I see patients in skilled nursing facilities across the community. We have a website, glyn.com, and they can send emails from that. There is a phone number, 716-800-CARE, and that would get somebody that could get you information around helpful resources, get you plugged in with what you may need, and kind of a single point resource for people to direct in the right place. We can help you find a primary care physician if you need one, and get you referred. And hopefully, if you ever end up in a skilled nursing facility, you'll see me or one of my team, and we'll get you back to home.
Wow. Well, thank you so much, Dr. Shields. You have been a breath of fresh air this Saturday morning, and I'm hoping our listeners have gained something, have gained a tip, at least one tip that you've taken away. And so I want to thank you, Dr. Shields, for being our guest this morning on the Great Lakes Health Radio program. And 2 weeks, God be willing, you will hear me again, Francesca Messiah from Kaleida Health. However, next week, you'll hear from my esteemed colleague, and that is Cindy Bass from Erie County Medical Center, often known as ECMC. Thank you. Take good care of yourself. And remember, walking is one of the best exercises for all of us. Even if you're on a walker, movement is great. And again, I want to thank you from the bottom of my heart for listening to the Great Lakes Health Radio program with your host, Francesca Messiah, Manager of Workforce Development. And 2 weeks, God be willing, you'll hear me and some great along with some interesting guests. Thank you so much for listening. Bye-bye.